An orientation workshop for key government stakeholders on the Sikkim Integrated Mental Health and Suicide Prevention Strategy, the state's first localized mental health strategy, was held on 19th May at Chintan Bhawan. The workshop was organized by Sikkim INSPIRES program, Health and Family Welfare Department, and Planning and Development Department, Government of Sikkim. Addressing the inaugural session, the Health Minister Mr GT Dhungel highlighted the importance of collective action in tackling one of society's most urgent concern, that is mental health and suicide prevention. He said that while mental health falls under the purview of the health department, the collaborative participation of the multiple departments and stakeholders is vital for achieving meaningful outcomes. He added that the pain of mental health challenges had impacted nearly every family, school, and community in the state. He called for a move from dialogue to action, stressing that the Sikkim Integrated Mental Health and Suicide Prevention Strategy must materialize on the ground rather than remain a document confined to paper. He commended the effort of Sikkim Inspires team, the Center for Mental Health Law and Policy, Indian Law Society Pune, and all stakeholders involved in the drafting the strategy. Mr. Dhungel also suggested integrating bibliotherapy and using reading as a form of engagement and healing into mental health interventions. He called for ensuring availability of counselors and helplines in every district. He further stressed the need for digitalized mental health data, suggesting that such system would allow for easy access and effective monitoring, thereby strengthening service delivery across the state. He called on all the stakeholders to treat the implementation as a shared responsibility and reaffirm the government's commitment to making mental health care inclusive, accessible, and rights based. In his remarks, Commissioner cum Secretary of the Health Department, Mr. Prabhakar Verma, underscored the urgent need for a concentrated and collaborative approach to address the rising mental health challenges in Sikkim, particularly among the youth. In his brief address, Secretary Planning and Development Mr. Rinzing Bhutia extended his gratitude to all the line departments, partners, organizations, and stakeholders for the collaborative effort in shaping the Sikkim Integrated Mental Health and Suicide Prevention Strategy. He stressed the importance of interdepartmental coordination and sustained commitment to ensure the effective implementation of the strategies across the state. Additional Director, Family and Health Welfare Department, Dr. Karma Chaden Bhutia, gave a presentation on overview on implementation of school health and wellness program.
Really, I'm very thankful to the Honorable Chief Minister. Under his guidance and the Development and Planning Department, they have been involved, and their counterpart Ms. Rohini is also there, involved, leading the Inspire team. Under the guidance involving all the stakeholders from different departments, the documentation has been formulated. Now it needs to be seen and it needs to be implemented. So the whatever policies and other actions have been drawn up that should materialize on ground. Yes, everyone should be involved. See, like mental health is such a thing. If you go and see in your home front only, every individual, every family, every society is affected by this. So it should be the duty of everyone to see that they should know what is what, and they should know how to interact with this and how to implement this, so that at the end the combined effort of all the persons will make it into an effective tool, and then that will materialize the policies and documentations, whatever is framed.
Right. So, sir, minors are also committed suicide. So, what is the reason behind?
No, there are a lot of other factors. No, like as we said, substance abuse is there, alcoholism is there. They have peer pressure. They have like education also. If you see from they have pressure, and the societal pressure is there. All the factors combining all these things, they ultimately ground them and lead them into all this mental sickness that leads to suicide and other activities which are very unwelcome for the society.
So in today's meeting, you also gave some suggestions to the department, such as to maintain the data. Would you like?
Yes, it's very essential. See, like whatever we do, it should be available, because today is a day where everything is guided by digital, and then AI is also there. So whatever data we collect, that should be fed into the system. So when people want to know who's sick and who's recovered and who's to be treated, all those things will be available. Not only that, besides that, all the information, which centers are treating that, which persons are dealing with that, where to go and what to do, all those data will be available. So when they have that information on hand, at the click of the fingers, they'll know what is to be done and where to go and whom to approach, and what are the like preventive measures to be taken that they can resort to.
So we have often seen like policymakers plays very important role in the implementation, and especially the politicians. But we have seen like many politicians openly doesn't talk about suicide and mental health. Is there any message to your colleagues, your peers?
No, this is the time. Suicide and mental health is affecting every nook and corner, every constituency, every village. So it is our responsibility to see that how these things can be addressed. Now, since the INSPIRES team under the leadership and under the able guidance of the Honorable Chief Minister, they have come up with the documentation. Now that should be circulated in a wide way, and it should trickle down to everyone. No, the knowledge, whatever it is, it should disseminate so that everyone can get hold of it, and then when they know that, they should excise that also, so that we can prevent suicide to a great extent, avoid mental health, and try to create a atmosphere which is very congenial and peaceful and livable.
So a big responsibility for public representatives.
Yes, very much. We have been chosen by the people to work for them, and if you see, we need to have the servant attitude as public representatives.
The strategy that was released recently on the occasion of the State Day on 16th May at Paljo Stadium by the Honorable Chief Minister and the Honorable Governor. This document has been prepared in consultation with almost all the stakeholders in the state as well as from outside. For instance, the Center for Mental Health, Law and Policy Pune has played a very important role in formulating this document. This strategy document, Sikkim Mental Health and Suicide Prevention Strategy, which was released recently, as I said earlier. Now today we are deliberating on how to implement this strategy in the state, so that the results come out, so that we can sort of achieve better results and are able to reduce cases of suicide and mental health in the state.
So what would be your action plan for the implementation?
This is a multi-sectoral issue actually, and only the health department or the social welfare department will not be able to tackle this issue on their own. So this needs a collaborative effort from all the stakeholders, including the public, the panchayats, the elected representatives, the government employees, the government, the department. So everybody has to be aware, has to be made aware of this strategy that we have formulated, and how to implement these strategies. So today's meeting, the post-inaugural meeting, technical session would be very important, because today we are going to now outline our future course of action on how to implement this strategy.